Welcome. I'm Dr. Douglas Wingate, Integrative Neurorehabilitation Specialist and Neurogen Brain Balancing Practitioner. Here I want to talk about veterans, active service members, military families, and the providers who serve them. I want to talk about something that I believe represents a genuine turning point in veteran brain health care: Neurogen Brain Balancing, and specifically about a program we offer through the nonprofit pb4vets.org that allows qualifying veterans to access 4 free sessions at absolutely no cost. Military service asks extraordinary things of the human nervous system and the brain. While our culture has become somewhat better at acknowledging these sacrifices, treatment often lags far behind the need. The invisible wounds of service take many forms. PTSD is perhaps the most recognized, the nervous system locked in survival mode long after the threat has passed, with re-experiencing hypervigilance and avoidance that can make ordinary life feel impossible. Traumatic brain injury from blast exposure or training accidents leave structural brain changes that can affect cognition, emotion, and behavior, often for years before they're even diagnosed. The moral injuries that one deals with is both distinct from PTSD and frequently undertreated, and sometimes mistaken for depression or treatment resistance. Military sexual trauma, which affects veterans of all genders, is one of the most significant and underacknowledged drivers of PTSD in the veteran population. None of these are soft complaints. They're measurable neurological injuries, and they deserve neurological support. So let me be direct about the scope of what we're dealing with. Between 10 and 30% of veterans with combat exposure develop PTSD. PTSD has become the signature wound of modern warfare. Nearly 44% of military personnel who sustained a traumatic brain injury met full PTSD criteria. And about 400,000 veterans are estimated to be living with undiagnosed traumatic brain injury, blast injuries that went undetected for years before symptoms emerged. And maybe most urgently, around 22 veterans die by suicide every single day in the United States. These aren't statistics. These are our family members, our friends, our neighbors, our heroes. The need for effective, accessible, veteran-centered care has never been greater. So why, with this level of need, are so many veterans still struggling? The answer isn't a lack of effort. It's that conventional treatment pathways weren't designed for the neurological complexity that veterans present with. Co-occurring traumatic brain injury, PTSD, and chronic pain share overlapping brain dysregulation that standard protocols weren't built to address simultaneously. Polypharmacy is common, with many veterans on 4 to 8 or even more medications, with significant side effect burdens and incomplete symptom relief. Military culture has historically framed mental health care as weakness. Passive, non-clinical feeling interventions like Neurogen meaningfully reduce that barrier. You don't have to identify as a mental health patient to access it. Verbal therapies require active trauma processing, which can be profoundly difficult for veterans with severe avoidance, dissociation, or traumatic brain injury-related cognitive impairments. And the VA treatment gap is real. Wait times, geographic barriers, and resource limitations leave many veterans without access to the care that they've earned. Neurogen was built in many ways for exactly this gap. Literally, the founder, Master Gunnery Sergeant Greg Gillespie, who retired after a distinguished 30-year career in the Marine Corps, set out with a goal of helping as many veterans as possible after his own incredible journey. Neurogen brain balancing is described in the peer-reviewed literature as a novel, passive, non-invasive neurobiomodulation modality for brain health. 4 features make it particularly suited for veteran care. First, the passive protocol. There's no active tasks, there's no screens, no verbal processing of traumas. The person comes in and rests while the brain and the system does the work. This is uniquely suited to veterans with avoidance symptoms or cognitive fatigue from TBI. Second, real-time EEG guidance. Live brainwave data drives every single session minute by minute, generating a protocol specific to that person's brain and what it's doing right now. No two sessions are identical. Third, lip test signaling. Low intensity pulse transcranial electrical stimulation delivers gentle, imperceptible microcurrent signals that provide the nervous system a reference for self-regulation. And fourth, neuroplasticity support. By targeting maladaptive brainwave patterns, Neurogen supports the brain's ability to reorganize itself and reverse changes caused by trauma, blast injury, and chronic stress. Every pattern of brain dysregulation commonly seen in veteran presentations maps directly to a neurogen effect. This is the heart of neurogen's efficacy. Amygdala hyperactivation from PTSD is addressed through reduction of the pathological slow wave activity that sustains that chronic alarm state. Abnormal slow wave activity from blast TBIs, which has been directly measured on MEG neuroimaging, is reduced post-treatment. Sympathetic overdrive responds to vagal nerve modulation, shifting the nervous system from fight or flight toward what I call the rest and regulate state. Chronic neuroinflammation, which underlies so much of the cognitive and emotional dysregulation in this population, is thought to improve through neurogen's influence on microglial activity. Sleep dysregulation, one of the most common and most debilitating veteran complaints, improves as the autonomic nervous system rebalances and deeper sleep cycles are restored. And the cognitive fog and executive dysfunction that affects so many veterans with TBI or PTSD are addressed through the support of prefrontal subcortical connectivity. This isn't a general wellness protocol. It's a targeted, neurologically grounded intervention that speaks directly to what's happening in the veteran brain. Here's the evidence that anchors all of this. In an observational study of 80 veterans who completed 4 weekly Neurogen sessions, 80% reported measurable improvements in their conditions. The most commonly improved symptoms included PTSD, anxiety, depression, sleep disturbances, chronic pain, cognitive dysfunction, and brain fog. This was published in 2025 by Drs. Kassian and Turetsky in the peer-reviewed Journal of Health. I want to pause on that number for a second. There were 4 sessions, and 80% of an 80 veteran cohort reported measurable improvement. That's a remarkable outcome for a population that's frequently treatment resistant. And I want to say this clearly for any veteran watching or listening. Through bb4vets.org, U.S. military veterans can access those same 4 Neurogen sessions completely free of charge. No cost, no barriers. This program exists because veterans deserve access to the most effective care available, regardless of financial circumstances. So let's take a moment to describe what actually happens in a Neurogen session, because I find that the experience itself is often what convinces veterans to continue with care. You arrive and settle in. There's no forms to fill out in the room, no intake questionnaire to trigger you. You sit or recline comfortably. EEG sensors are gently placed on the scalp. It's non-invasive, painless, and takes just a couple of minutes. The system then reads your brain's live electrical activity and generates a session protocol in real time based on what it finds. Then you rest. That's it. You can close your eyes if you want. There is no task, no performance, no reliving anything. You don't have to talk about what happened. You don't have to revisit it at all. Many veterans report a noticeable shift, a sense of calm or mental clarity or reduced physical tension even after the very first session. The changes accumulate and deepen over the course of treatment. For any veteran or family member watching, here is who the program is for and how to get connected. Strong candidates include veterans with PTSD from any source, combat, military sexual trauma, or training-related events, veterans with blast injury, traumatic brain injury, or post-concussion syndrome, those who have hit the limits of VA care or conventional treatment, anyone experiencing medication fatigue or who's specifically looking for drug-free options, veterans with comorbid anxiety, depression, or chronic pain, transitioning service members navigating the adjustment to civilian life, and importantly, the families and caregivers of veterans who carry their own significant burden and deserve support also. For access, visit acuneuromodulation.com for full information about our integrative neurorehabilitation practice and to book a consultation. For the veteran-specific free session program, visit bb4vets.org. This is the dedicated portal for qualifying veterans to access 4 free Neurogen sessions through our nonprofit partnership. And Neurogen works alongside existing VA care. It's not a replacement for therapy, medication management, or peer support, but a powerful complement to all of those. You served. You deserve more than being told to just learn to live with it. Too many veterans have been handed that message from providers, from a system stretched too thin, from a culture that mistakes stoicism for healing. Neurogen Brain Balancing offers something different, a safe, drug-free, evidence-informed path to genuine neurological healing. And through bv4vets.org, U.S. military veterans can take the first 4 steps of that journey at absolutely no cost. If you're a veteran, a family member, or a provider, I invite you to reach out. Visit acuneuromodulation.com or bb4vets.org. We're here to help. Thank you for your service, and thank you for your time.